And it is a good morning, isn't it? There is, I think, for many people, a light at the end of the tunnel. Just in terms of the roadmap, we do understand, of course, there are always differences of opinion around the cabinet room table. Different ministers have different emphases. This roadmap feels like it does have an awful lot of influence from yourself, from the Department of Health. I mean, this is pretty much what you were looking for, wasn't it?
Well, you would expect the Department for Health to have an impact on the roadmap for coming out of a pandemic. But actually, there was remarkable levels of unanimity in government. Of course, it's totally normal to have debates, in this case, largely around the details, because we're all absolutely determined to come out of this as fast as safely possible. But no faster. And the safety is important. And we're determined, as the Prime Minister puts it, that this should be irreversible. That is the goal. And then it's a judgment about how much we can lift at what moment. But it's not just a judgment for us. It's actually on everyone. And this is one of the points I want to stress, is that this isn't just about choices the government makes. It's actually about how everybody responds and pulls together. So for now, it is so important that people stick to the existing rules. We can see the light at the end of the tunnel, and the best way to get there is for everybody to keep abiding by the rules as they are in very, very large part. And then as we release things, we need to move at that pace, because that is what we expect to be the safe way to get out of this as fast as we can as we roll out the vaccine programme, because all of this is only possible because of that rollout.
Indeed, and I want to kind of quiz you a little bit more deeply about the vaccine efficacy, because great data from Chris Whitty yesterday. I think plenty of people will have sat up straight at that point. But in terms of the pace of relaxation, it strikes me, you heard from Steve Baker just a moment ago, demanding that perhaps we could move quicker. Under the scheme, under the roadmap as announced, it doesn't look like actually there is any scope for moving any quicker because of that 5-week gap between the steps.
Well, that's right. It's very, very important that we can see the impact of one step before taking the next step. And now there are some. There's just a vital need to keep watching the data, and for all of us, and I mean everybody watching and the whole of society, to stick with this plan. We want to be able to hit those milestones, but we'll be vigilant and watch what's happening to make sure it's safe to make each move. And the Prime Minister set out the 4 tests that we will apply before announcing that each move can go ahead. But of course, we want to make the moves at the dates that are set out. But it's on all of us to make sure that we can, by continuing to follow the rules between now and then, as the vaccine rollout continues and as the really, really positive impact of those vaccines takes effect. This is on all of us.
A key aspect of this is, of course, moving out on a national rather than a regional basis. Do you think people like Steve Baker will ultimately accept that? I understand the rationale for it, but, for example, if we saw cases rising in and around London, meaning that, people in Devon and Cornwall couldn't see restrictions relaxed in their area. Do you think that people, first of all, in Devon and Cornwall would accept that, whether people in your party would accept that?
Well, we have seen actually that the rates went up right across the country, and then in this national lockdown have been coming down right across the country, more so than previously, actually. Now, there are some parts of the country, very small targeted areas, where we find new variants that we're worried about, the new variants that might not be dealt with in the same way by the vaccine. And we've put in particular measures in those localised areas, for instance, some around Bristol, around Woking, around Sefton in Merseyside. But that's very much the exception. The goal here is that we all move together across England, and Nicola Sturgeon's setting out the path for Scotland, and the Welsh and Northern Irish administrations will set out their path. But essentially, across England, a national approach we think is the right one, yeah.
Clearly, it does feel that those variants may well be the stumbling point, or at least the point that they may result in the pause button being hit. I'm just wondering what the government's modelling is telling us, what this kind of roadmap, the relaxation, will do as regards the South African variant, the Brazilian variant.
Well, the good news is that the number of new variant cases we're finding across the whole UK is falling, and has fallen quite sharply over the last month. And in the last a week or so, there were just over a dozen new cases, which is far smaller than we were seeing even a couple of weeks ago. So the extra measures that we're taking at the border are working. And also the lower case rate makes it much less likely that there'll be new variants here, because new variants tend to arrive when you've got an area that's got a very high case rate and the virus is trying to escape from the immunity that people are getting naturally. Now, we need to do continued work to understand how effective the vaccines are against these new variants. We now know that the vaccines are extremely effective in the real world, in the UK right now, against the main variant here, the so-called Kent variant. That is what is, the vast majority of cases here are. But we do have to protect against these new variants, and that is a big challenge. One of the reviews announced yesterday is a review into international travel, and that review will be informed by the evidence that we're currently collecting on the impact of the vaccine on the so-called South Africa and Brazil new variants. If the vaccine works well against them, then we can be much more relaxed about international travel. If the vaccine doesn't work against them, then that will be much, much more difficult.
Just in terms of, we mentioned it before, fantastic data in terms of vaccine efficacy. And indeed, you and I spoke a few weeks ago, and there was a hint already at that point that there was data confirming that. Do we have enough information yet on what effect the vaccines are having on transmissibility?
Well, the evidence published by Public Health England yesterday demonstrate that there is a reduction of around 70% in your chance of catching the virus, and there's obviously a link from that to transmissibility. If you don't have the virus, then you can't easily transmit it, obviously. And then an even bigger impact in terms of death and hospitalization. So this is a really, really good result. I had confidence that we'd get a vaccine. I have huge confidence in the NHS to roll out the vaccine, and it's wonderful to see the effect of the vaccine saving lives in the UK right now, not just in a lab, not just in a trial, but the vaccines are saving lives right now. And you can see the result in the real world data as well, because if you look at the number of people who are dying each day, that number is falling sharply. It's actually falling more sharply than it was even a couple of weeks ago. So the halving rate of deaths is accelerating. And that's despite the fact that the halving rate of hospital admissions is holding steady. So this is real world information showing that the vaccines are working to save lives in the UK right now. And that obviously is incredibly encouraging.
Yeah, very encouraging indeed. Can we talk about business? I mean, we've obviously heard a number of times the government stands ready to do whatever it takes to protect livelihoods and businesses. Of course, the roadmap published yesterday sets out a route all the way till the tail end of June. If I'm a small, medium-sized business owner this morning, it wouldn't be daft for me, would it, to assume that furlough business rates relief is going to be extended till the end of June as well?
Well, you tempt me, no, but that's very much a matter for the Chancellor, and he'll be setting out.
We could do with hearing from him right now, couldn't we? Now that we've had the roadmap, I understand the budget is in a week's time, and I see you smiling there. But there will be business owners watching this who are perhaps not so sanguine about the fact they have to wait another 7 days to know.
Well, look, I understand that. And coming from a small business background myself, I entirely understand the impact of this on small businesses. And it's been devastating for some and difficult for most. And the level of economic support that the government's put in is both unprecedented and bigger than almost anywhere else in the world. And the Chancellor is going to set out more details next week.
Can we dwell for a second, Health Secretary, on the judgment handed down by the High Court last week? And a lot of ground has been gone over. I'm not asking you for an apology. I'm not asking whether or not you're going to resign. I do think it's worthwhile asking, though, whether you understand why there are quite so many people concerned about the procurement process. There is an opaque quality to it. A number of contracts have been awarded to people that you and others within government have personal relationships of some form or another with. Do you understand why? And I get the rationale for why you had to operate in this way. I understand your position. But do you also understand that perhaps in the not too distant future, people would like to know that all of those contracts have been awarded in a proper way? Would you be accepting of the possibility of an independent inquiry, getting the transparency on your department that a lot of people are after?
Well, that transparency is there. So the good news is that there already has been an inquiry into this by the National Audit Office, and they published their results, which found that there wasn't a problem with any of the individual contracts. And indeed, this court case wasn't about the individual contracts.
They also refused to rule out criminal abuse.
If I just answer the question, you asked for transparency. The only reason that people know about these contracts is because of the transparency rules that we rightly have in place. And because we published all of the details, now we published them around, on average, a couple of weeks late. And that's what the court case was about. But it wasn't about the substance of the contracts, because that's already been looked into by the National Audit Office. And all of them have stood up to scrutiny. Now, people then say, but hold on, some people you knew got contracts. Well, are you saying that if you know a minister, then you shouldn't be allowed to have contracts? So I didn't.
No, but perhaps there might need to be a little bit more scrutiny.
Well, there's been enormous amounts of scrutiny, and as this conversation attests, and the reason that we can have this discussion is because we have that transparency, and the contracts in question. I didn't have personal involvement in the signing of the individual contracts. But sure, what I did do is make sure that my team were given all the support they could to buy PPE to save lives. And, we as you say, we have been through this. And I think, the argument that I'm making is the argument that not only anybody in my position would have made and would have done, but also it's what the public expect, right? They'd expect me as Health Secretary to ensure my team had all the support they possibly could.
You can't have it both ways. I mean, the judge in the case said that the history of these proceedings is unedifying. The lion's share of the blame lies with the Secretary of State, lies with you. £200,000 was spent on legal fees for a case that didn't need to happen because you could have simply said, yes, we were in breach.
Well, it's absolutely true that the case didn't need to happen because it was it hasn't had any material impact. So you'll have to ask the people who brought the case why they did that.
To get you to accept that you were in breach. As the judge said, I have no doubt the claim has speeded up compliance.
But we accepted in full that these things were published a fortnight late. That isn't in dispute. What we argued was we argued a public interest defence. It's in the national interest that we did what we did. And my team, who are an amazing group of people, worked incredibly hard to save lives. And that's what we do in the health department. And sure, if we weren't able to put the paperwork in on time, in normal times, of course we put the paperwork in on time. But in the middle of a global pandemic, you don't. So you can ask me as many questions as you like. You're not going to change my view. And if I had my time again, absolutely, I'd do exactly the same thing, even if it led to this conversation. Because what I care about is making sure that people have the protection they need. And I care deeply about the staff of the NHS and the staff who work in social care. And I care deeply that they have everything they need. And it was really tough. But there wasn't a national shortage at any point. There were difficulties in individual areas, but there was never a national shortage. And that's because of the work that my team did. And I'm very, very proud of them.